What is a birthing experience worth? Is it worth a mother's safety? Is it worth a mother feeling silenced? Is it worth her peace of mind or her ability to advocate for herself? In our society, mother's birthing experience is determined by the way we feel, if we felt empowered, if we felt listened to. Every mother deserves to not only survive childbirth, but to thrive in it. Yet, in the United States, today it is deeply troubling. We are in the midst of a maternal health crisis. According to the CDC, Black women are 3 to 4 times more likely to die from pregnancy-related causes. 82% of these deaths are preventable. These numbers represent lives, families, and futures that were tragically cut short. Doulas can help change these outcomes. Doulas are not just caregivers. They are guides, they are advocates, and most importantly, they are lifelines to mothers who are navigating a healthcare system that has continued to fail several times over to listen to them. Doulas provide evidence-based research, comfort support, information to help prepare clients for their pregnancy journey. For example, you have Tracy, a client who had a 9-centimeter fibroid, which is a growth the size of a baseball, while she was pregnant. The doctors checked it throughout her pregnancy to make sure it wasn't growing. Yet, the day of labor, we get into the room, I remind the healthcare team that she has a 9-centimeter fibroid, and since she's going for a natural childbirth, that is something we need to pay attention to. They all looked puzzled and said, she doesn't have a 9-centimeter fibroid. That's not true. And as her doula, I said, yes, can you check the charts? Because we want to be prepared. She goes on, she has a beautiful natural birth. Yet, after the baby is here and baby is resting on mom, she starts to hemorrhage. Hemorrhage means bleed out. The providers are searching for a tear in the perineum. I say, that is the 9-centimeter fibroid. It is acting as if it wants to come out. They all look puzzled again and say, what is she talking about? She doesn't have a 9-centimeter fibroid. And I said, can you please check her chart? And in the midst of this, as the doula, my job is also to keep the patient calm. So once they find it, they're like, oh my gosh, she does have a 9-centimeter fibroid. In these instances, what if she did not have me as her doula? They would have wasted time. By the time they actually came to realize what was actually going on, she had already lost 2 liters of blood. And so you have to think to yourself, what is actually going on within the healthcare system? Why are Black women constantly not listened to? Why is it important for every woman to have a doula? Someone who is there constantly, someone who is going to listen and help them navigate and guide them throughout the process. Someone who's going to be the voice when they don't have one to speak for them. And so you have to really think about, why is it that so many Black women are actually dying? Think about the healthcare system. This is systemic racism. This is bias within the healthcare systems that no one is continuing to talk about. It's always the blame game. It's always Black people have larger disparities than everyone. And that is not true. And so think to yourself, how can you actually be a part of the change? How can you help women, all women, advocate for themselves? How can you gear up with organizations that are training doulas, that are training clients on how to be prepared for things like this? Doulas can't do it alone. It takes agents of change. It takes everyone to do their part. Think to yourself, do you want to be a part of the change? Or do you want to sit back and let these women fight in silence? Think about your birthing experience or your family's birthing experience. What does that feel like? What stories have they told you? How can we keep the healthcare system held accountable? Think about that. When it comes to maternal mortality, Black women are 3 times more likely to die than white women. Are you going to sit back, or are you going to be a part of the change? Every woman deserves to not only survive during childbirth, but to thrive. Thank you.